come in.
Hi, I'm Dr. Clifton, and I'll be your caregiver today.
Nice to meet you.
So today I'm just going to be checking your blood pressure. Is that okay with you?
Yes.
All right, awesome. The first step I'm going to do is apply some hand sanitizer to wash my hands, just so that I don't get anything on you that you don't want on you. Okay. And now I'm going to sterilize the instruments. I'm cleaning the bell of the stethoscope, the earplugs, and the bulb. Okay. After doing this, I'm going to don my gloves. After donning my gloves, I will then ask the patient to rest their arm on a nearby table to keep their arm in the cuff at level with their heart. The patient now has been sitting for 5 minutes comfortably with her feet planted on the ground. I'm going to ask the patient to roll up her sleeves. Thank you. Okay. After the patient rolls up her sleeves, I will be taking my blood pressure cuff. This is the bulb in which I will be using to inflate the cuff. And these are the arrows I will be using to designate where I will be placing the cuff. So since the patient is using her right arm, I will use the right arrow and place the cuff just barely above the crease of the elbow. I won't put the cuff on too tightly because I don't want to restrict blood flow so quickly. Okay. I will now turn the bulb clockwise and find the patient's pulse. Okay. I'm going to pump the bulb very quickly until I can't feel the pulse anymore. Okay. The patient's pulse was gone after about 115, and so I will add 30 to that, and I will start finding her blood pressure at 145. I will remove the cuff for approximately 2 to 5 minutes to give the patient's arm a rest. That way we don't cause any harm to the patient. So now that the patient has been sitting here for about 5 minutes, I'm going to reapply the cuff and now take her systolic and diastolic pressure. Using the number that we found, I will start at 145. I use the same methods to reapply the cuff that I did last time. Placing the cuff just barely above her elbow crease, enough to where I can get my stethoscope in there to hear her heartbeat. Okay, now that I've applied the cuff, I'm going to position my stethoscope and place the bell directly on the brachial artery, trying to avoid all of the tubes that are connected to the blood pressure cuff, as that will create excess noise, which will get in the way of listening to the heartbeat. I place my thumb on top of the bell and the rest of my fingers directly on her elbow so that I have a firm grip, and I turn my valve all the way to the right. I'm going to start at 145 and get lower from there, and slowly releasing my valve. All right, the patient's blood pressure was 115/70, which is well within the normal range for a healthy teenager. After that is finished, I will finally remove the blood pressure cuff and record my findings in the patient's medical records. After that is all said and done, I will begin to disinfect again all of my equipment. starting with the bulb, the earplugs of my stethoscope, and finishing off with the bell. I don't throw all my trash away at once until I have all of it together. I remove my gloves. Wash my hands again. Sorry, that's gonna be cut. And then I will shake the patient's hand. Thank you so much for your time.
Thank you.